Okay, bear with me on this video, guys. This is going to be a bit of an involved one. What we're looking at here is activity-based funding, and you've probably heard about activity-based funding mostly from when the Rudd government implemented it as a national reform for healthcare across Australia. Before that, it was very much specific to Victoria. Victoria was sort of the leaders in the whole idea of activity-based funding. We'll also be looking at, really briefly at the end, just to top off this in this video, is cost containment and how that is as a strategy and how we might look at that in healthcare. So activities-based funding. This is a system in which governments can actually fund a contribution to a public hospital and hospital service. And it's used to monitor, manage and administrate the funding of the healthcare system and the healthcare provided by public hospitals. The main building blocks of activity-based funding include three key areas. These are classification, counting and costing. This results in the funding transparency of the public hospital system. So, what do we actually need to think about a little bit furthermore when we go into activity-based funding? We've got a good example and an idea around what it is. And it really is exactly what it says it is. It's not rocket science. Basically, funds are provided based on the activity that the hospital or service actually undertakes. And because most hospital activity involves treating patients, or cases as it is, the term case mix funding is also used. And we'll look at that in another video. So, what do we actually get funded by activity-based funded? So the things that we get funded on are things like acute inpatient administration, such as surgery, medical admissions, maternity, paediatrics, emergency department services, subacute care, outpatient services, health and service, Centre for Health and Service Development, and also those hospital auspiced community type organisations. What do we not fund with healthcare though, with activity-based funding, sorry? We don't fund things like teaching and learning. So teaching for staff and students and learning by interns and residents and that side of things. It doesn't fund any sort of research-based areas. It doesn't fund travel, it doesn't fund affiliated agencies, and it doesn't fund things like interpreter services and Aboriginal liaison support services. So that gives you a quick view of ABF, and we'll go through a little bit more detail in our sessions online this week. One thing to end out this video is cost containment. What do we mean by cost containment? We want to keep things within the limits that we're actually setting them. So we don't want to have an element of resources that we just all of a sudden use and abuse very quickly and find ourselves going, well, how do we fund everything now? So what we want to do within a healthcare setting, and this is where we look at ensuring that the efficient and effective use of resources, as we looked at in the previous videos this week, is actually utilised in a way that is not beyond what it should be. And that's it for this video, and I'll see you in the next one.